Welcome to an overview of the Voluntary National Retail Food Regulatory Program Standards Mentorship Program. The Mentorship Program has been made through a cooperative agreement between the Food and Drug Administration, FDA, and the National Association of County and City Health Officials, NACCHO. It is part of a multi-year initiative to strengthen the role of local health departments and promote effective county and city regulatory programs responsible for retail food protection in the United States. The FDA NACCHO Cooperative Agreement has three specific aims or goals. The first, to enhance and expand NACCHO's food safety peer mentorship program in order to increase state and local health departments' participation in and the conformance with the retail program standards. The second, to assess and identify best practices on how state and local departments use the retail program standards as a tool for fostering continuous improvement in their agency. And finally, the third, to better understand the role of local health departments play in regulatory policy issues, for example, menu labeling regulations, food defense, food donations, food banks, cottage foods, and to identify how food safety interfaces with these regulatory policy issues. The mentorship program focuses specifically on Aim 1 of the Cooperative Agreement. The Voluntary National Retail Program Standards, known as the Retail Program Standards, serve as a guide to regulatory retail food program managers in the design and management of a retail food regulatory program and provide a means of recognition for those programs that meet these standards. Program managers and administrators may establish additional requirements to meet individual program needs. When applied in the intended manner, the retail program standards should identify program areas where an agency can have the greatest impact on retail food safety, promote wider application of effective risk factor intervention strategies, assist in identifying program areas most in need of additional attention, provide information needed to justify maintenance or increase in program budgets, lead to innovations in program implementation and administration, and improve industry and consumer confidence in food protection programs by enhancing uniformity within and between regulatory agencies. The retail program standards are comprised of 9 standards. These include Standard number 1, regulatory foundation. Standard 2, trained regulatory staff. Standard 3, inspection program based on HACCP principles. Standard 4, uniform inspection program. Standard 5, foodborne illness and food defense preparedness and response. Standard 6, compliance and enforcement. Standard 7, industry and community relations. Standard 8, program support and resources. And Standard 9, program assessment. You can learn more about the standards on the FDA's webpage shown at the bottom of the screen. Now hear from Retail Food Regulatory Program staff about what the retail program standards mean to them and why they chose to enroll.
The Retail Program Standards benefits our agency by being able to provide guidelines and goals for us to strive to attain in order to have a better overall program.
I think it has benefited us the most through basically allowing us to have a uniform inspection program and overall like a quality assurance program. It's taken stuff that we've been doing and allowed us to put it down on paper and train our inspectors so that we are doing things that maybe we thought we were doing, but no, we didn't have any official written procedures. It was just kind of word of mouth. So now we have something to substantiate what it is that we're doing and be able to show new people as they come in, these are our procedures. We're able to take what we're doing and actually we can meet with the boards of health and show them, hey, we're trying to meet this gold standard here. These are the steps that we have taken to meet that. And so that, to me, that's what it is. It's allowed us to refocus our department to make sure that we're doing the things that we think we're doing.
So I think other health departments should enroll in the retail program standards. I mean, gosh, for any number of reasons. Certainly for reasons such as we had, where if you're looking to reinvigorate or reprioritize your food safety program, it's an excellent tool to set you on that path. If you already have an amazing food safety program, that's great, but I think it's still worth enrolling, because this is an opportunity to get an objective view of just how good it is. It's if for no other reason than just as a gap analysis tool of where your programs is in course, how it compares to sort of a gold standard, if you will. It's just a really good resource.
The goal of the mentorship program is to match retail food regulatory programs experienced in applying the retail program standards with peer programs in other jurisdictions currently enrolled in the retail program standards, and looking for guidance, tools and resources, and recommendations for making progress toward the conformance with the standards. This opportunity will provide capacity building among the retail food regulatory programs participating in the mentorship program. Participating retail food regulatory programs will identify ways to improve their programs and achieve conformance with one or more of the standards. From the agency or program perspectives, the anticipated outcomes and impacts of the mentorship program were intended and in many cases have included the following: improved retail food regulatory programs recognition of the value of the program standards, increased capacity within retail food regulatory programs to implement the program standards, promoted wider application of effective risk factor intervention strategies, lead to innovations in program implementation and administration, increased knowledge among NACCHO and FDA staff on the challenges and strengths of the program standards, and strengthen partnerships with peer retail food regulatory programs to help prevent foodborne illness and outbreaks. On an individual level, staff gained skills and benefits including a deeper understanding of the standards, public speaking skills, recognition as subject matter experts, networking and interacting with other health departments, ability to identify and pursue additional resources to conform to the standards, knowledge from trainings attended, such as FDA courses, HACCP training, conferences, and improved interactions and relationships with retail food industry. Now hear from retail food regulatory program staff as they describe how they have benefited from their participation in the mentorship program.
The mentorship program was really like the best thing all the way around. I know I've shared this story with other people before that I really, as much as I would encourage anybody to go through the retail program standards, I don't know how anybody who doesn't do it through mentorship does it the first time. Like it was so important, so helpful to us, to my agency, to just sort of demystify the program standards, to break them down and to expose us to them in a way that made them manageable and just less intimidating all the way around.
We really learn from each other. It's not just a one-way street. We're telling them everything they need to do. It was the open communication. So really, that was one of the helpful things for me. And I also know that the sharing of documents is out there. The Food Shield, being able to pull from other health departments, not recreating the wheel every time when you go to tackle one of these standards. You can just go to Food Shield. Hey, these departments have met these standards. And then you can get their documents, you can call them on the phone and talk to them. And most departments are willing to share. They want to, it's not like they're hanging on to that information. So it's kind of all one big happy family trying to head in the same direction. So.
We were able to sit down with NACCHO staff, with FDA staff, and with our mentors, Fairfax County, Virginia, to actually do a mock audit, and that was absolutely phenomenal, and we got a lot out of it. And honestly, when I went into my actual audit, I felt so prepared. I felt definitely more prepared than our auditor even at that point, by having gone through and sat with people who had gone through it, as well as the FDA, so the actual source, to answer our questions, and our audit went really smoothly. And then since then, we've had a lot of questions from other agencies in Colorado about the documents that we developed, and Fairfax helped us develop for Standard 2, and we've been sending that out and distributing it. And I think it's been really a good resource for other agencies.
Our mentorship participants have included retail food regulatory programs from across the country. The orange push pins indicate jurisdictions that received mentorship, and the purple push pins indicate jurisdictions that served as mentors. Approximately over 80 retail food regulatory programs have participated in the program. Participating jurisdictions come from diverse jurisdictional sizes, ranging from population sizes of 5,000 to over 2 million. 8 health departments that participated as mentees also served in later cohorts as mentors. This diagram presents an overview of the mentorship program structure. The mentorship program is typically 9 to 10 months long. The program begins with a kickoff call for participants, and during this call, the participants are given an overview of the mentorship program, timeline, expectations, tips and strategies, and an opportunity to ask questions. Mentors and mentees are expected to work together on their work plans and to schedule and conduct site visits. Participants are also expected to complete pre-assessments. Mentor and mentee sharing sessions will be scheduled throughout the program period to answer any questions, review expectations, and share updates on the participants' progress. Past sharing sessions have included how to get started in the Retail Program Standards, Standard 4, and Employee Health. When funding is available, an in-person meeting of the entire mentorship program cohort is held for participants to network and to share their experiences, challenges, and achievements. At the end of the mentorship program, all participating agencies are expected to complete a post-assessment or final report. NACCHO and FDA support to the participants include guidance and technical support, NACCHO facilitation of meetings, webinars, and project conference calls, access to mentorship food shield group that includes example resources and policies, announcements, and networking opportunities with other participants, NACCHO technical assistance and guidance to mentors. FDA retail food specialists are available to answer participant questions about the program standards, a copy of FDA's Retail Food Program Resource Disc, and travel stipends for mentor-mentee site visits. To make progress in the standards, participants have used the awarded funding in various ways. Examples include covering staff time, hiring additional staff members and interns, purchasing food safety program supplies, sending staff to trainings and conferences, and engaging the public in food safety training and education. Now hear how the communities have benefited from health department participation in work on the retail program standards. If you have any questions about the mentorship program, please feel free to contact NACCHO staff.
From our participation in the standard by us being capable of providing more trainings to those out in the communities. We're able to provide food safety trainings. We're able to provide better informational materials for them to use in working with food properly. I believe that a majority of our inspections, although some have their opportunities, but we're starting to see growth in how they go about their compliance within the establishments. So I think that it has been a great benefactor in improving overall compliance with food safety.
Community benefits because, actually very specifically, Standard 9 has the program do a risk factor study. And the risk factor study basically goes into the restaurants, we do a survey, and the survey tells us how well our program has gotten the information into the restaurants to minimize the risk factors for foodborne illness. Based on these surveys, we then can tailor our program to address the deficiencies that are identified in that survey. So the community benefits because we're continually improving our program by participating in the standards.
So I mean, our community has benefited in a number of ways. For instance, we've met Standard 2 and had that verified through an audit. So our community, both our citizens and our regulants, the restaurant operators and folks out there can have confidence in knowing that we've got a trained regulatory staff who's out there trying to consistently apply food safety knowledge and regulations at a high level. And that's just one concrete example of the way the community's benefited. The retail programs and standards themselves overall has improved our food safety program, which is a benefit to the community. Not every benefit will be as demonstrative as meeting Standard 2 is at this juncture because we're still working through them. But the progress that we've made has had significant impact on our food safety program for our community. It's made our food safety inspectors better inspectors. It's reinvigorated them. There's a renewed passion and interest to protect diners and to do a good job while they're out there. So I think it's been a wonderful benefit to the community.